My name's Paul Elkington. I'm 37. I had problems with my knees and I have had an osteotomy on my right leg. My stay at One Hatfield was really nice, pleasant. Everyone was very welcoming and friendly. Symptoms before the operation, my knee used to lock up and jam. I used to struggle getting off the floor without using something. I was on a fair amount of painkillers daily to just mask the pain whilst trying other things before having the surgery. I had my consultation with Mr Chatoo. I had some long leg x-rays. I went to see him again. We discussed the options of surgery and what will improve, make it better. And he just reassured me that it was the best way forward. What we were going to do would give me a good recovery and many years problem-free.
I'm Minhal Chatoo, consultant orthopaedic surgeon here at One Hatfield Hospital and specialise in surgery that preserves the knee joint. Paul was referred to me with severe right knee pain. He had tried all non-surgical treatments, and after a detailed assessment and investigations, it became clear that Paul was a good candidate for a knee osteotomy. An osteotomy is a surgical procedure performed around the knee joint to help relieve pain and improve function in patients with osteoarthritis once all non-surgical treatments have failed. There are several reasons why I performed an osteotomy in Paul's case, but the main reason was that an osteotomy not only relieves pain, but allowed Paul to keep his knee joint so he would have no restriction on activity after surgery. He would be allowed to run and play sport if he felt able to, as unlike after a knee replacement, there would be nothing artificial in his knee joint that could fail with high-level activity. As part of Paul's preoperative assessment, we carried out specialised long leg x-rays to look at his alignment. You can see that his right leg is bowed and his body weight is travelling through the inner aspect of his right knee where he has his arthritis. You can see that we have now done his osteotomy to realign the leg. You can see that his body weight is now travelling through the middle of the knee, and we've calculated that we need to open his shin bone by just over 9 millimeters. Once we have done the osteotomy, we fix the shin bone with a special plate and screws designed for osteotomies, and this plate is strong enough to allow patients to wait there fully immediately after the surgery. They do not require a plaster or a brace, and they usually go home the next day. This is an X-ray taken 3 months after Paul's surgery, and you can see that his body weight now is travelling through the middle of the knee joint, offloading the inside of his knee, and at this stage his pre-op pain has gone and he's functioning normally in day-to-day life.
The operation, the guys, anaesthetists, everyone pre-surgery was really pleasant. Told me what was going on, what was going to happen. After my operation, I was in recovery for a bit. Had a laugh and a joke with the ladies. Really nice, pleasant, food was good. Yeah, I can't really fault it, to be honest.
So I'm Nicole. I work at One Hatfield Hospital as the physio lead, but still do lots of clinical physio with the patients.
Patients like Paul, after osteotomy surgery, are usually able to do so much more than if they'd have had a knee replacement. Paul is able to kneel, sit cross-legged and jump, which is highly unlikely after having a knee replacement. Often, patients are told by their surgeons not to do impact exercise because of the concern of a knee replacement becoming loose. After an osteotomy, there is nothing artificial in the knee joint that can fail with any high-level activity. Therefore, there is no restriction on a patient wanting to run or jump if they feel able to do so.
It's changed my life in a big way. My mood, for a start. Even to my children, I can go out, play with them in the park, run around. I can sit on the floor and get back up again without using something to get back up. Day-to-day work, yeah, just general fitness. I feel healthier, happier, and I'm no longer on painkillers, so